Health is the only form of wealth that once lost can never be regained. That's the message from the Deputy Speaker of the House of Representatives, Benjamin Kalu, as Nigeria seeks international support to boost its healthcare system. Kalu made the remarks while hosting Philip Ozuah, President of Montefiore Medicine, at the National Assembly. The report.
The Deputy Speaker, Benjamin Kalu, emphasized that meaningful development cannot happen in a country where citizens still die from preventable diseases and lack access to quality health care. He pointed to ongoing legislative reforms, including expanded health funding, new policies, and efforts to tackle the exodus of medical professionals from Nigeria. Kalu proposed a partnership with Montefiore Medicine, focused on research, rural health outreach, and international knowledge exchange.
Health is the only form of wealth that cannot be regained once lost. Nations, hospitals, and clinics are critical infrastructures in safeguarding lives against diseases and poor health outcomes. Regardless of the quality of our laws or the scale of our budget, if preventable deaths continue, if maternal mortality remains high, and if citizens cannot recover from treatable illnesses, our development remains incomplete.
As was mentioned earlier, 7.5 million patients that we take care of annually. There are more than 55,000 staff members, 10,000 doctors. When we remain on a growth trajectory, just this past year, we've opened a breast cancer center, another imaging center, radiology practice, family health center. This is a center in Hudson Yards in Manhattan with Amazon.
Members of the House also reiterated their comment to boosting investment and deepening U.S.-Nigeria legislative and business collaboration.
And we look forward to getting more Nigeria to come and invest more, because the essence of the committee is to deepen a parliamentary friendship and relationship, and equally to deepening collaborative business engagement. The 10th Assembly under Your Excellency are no longer interested in aids. We're interested in collaborative partnership.
You see somebody looking very decent, this and that. Well, challenges there. So we're looking towards the areas where you can go collaborations, where all of us will fiscally fit. Remember, there are pressures here and there.
You know, in the healthcare sector, one of the key things that we've realized that unless you have a match between the public and the private, we will not be able to bring the efficiency that is needed in the healthcare provision.
Meanwhile, the Rivers State National Assembly caucus has condemned Senator Henry Serake Dixon over what they describe as unwarranted and inciting comments on emergency rule in the state. Chinda, speaking on behalf of the group, warned the former governor to refrain from further inflammatory remarks, stating they could lead to unrest.
Let it be categorically stated that Rivers State is not under military rule. The current administrator of the state, Vice Admiral retired Ebok Ete Ebas, is a retired military officer, just as Senator Seriake Dixon is himself a retired police corporal, but a serving senator.
The caucus criticized the senator, a former police corporal, from allegedly making statements unbecoming of his background in law enforcement.
We will also call on the security agencies to put a tab on him and his actions, which are likely and capable of causing a breach of peace, particularly now that the state is working towards restoring peace amongst our citizens. We will also call on the Senate Committee on Ethics to commence investigation into the unparliamentary actions of Seriake Dixon.
The lawmakers called on security agencies to monitor his activities and urged the Senate Committee on Ethics to launch a formal investigation.